whenever you're ready, sir.
Thank you very much, Mr. Chairman. Thank you for hearing the bill today. I know you've had a long hearing. And so I'm here to present on SB 239. I'm here with my partner in the legislation, Assemblymember Gloria, and I want to thank him for his work with us to move this public health bill forward. So, colleagues, SB 239 will bring an end to the targeting of people living with HIV by bringing parity between HIV and other infectious diseases. In California, we are currently criminalizing people living with HIV, and it needs to come to an end. Over 25 years ago, California passed several laws creating new felonies relating to HIV and penalties that don't exist for any other infectious disease, including very serious ones, for example, Ebola or other very serious infectious diseases. Only HIV is singled out for harsh criminal treatment. Under these laws, you can be convicted of a felony and sent to state prison if you're HIV positive, even if you did not infect anyone with HIV, and even if there was no risk of infection. And we know today, unlike when these laws were passed, that if you are HIV positive and you are on antiretroviral medication, you are not infectious. You probably can't even infect someone if you were to try, and yet you are still guilty of a felony. HIV is a different epidemic today than it was in the late 80s and early 90s when these laws were passed, both in terms of the health and viral suppression and resulting non-infectiousness of people living with HIV, in addition to the prevention tools we have today that did not exist back then. We know that these laws, based on research that's been done, these laws do nothing to actually prevent HIV infections, but what they do is stigmatize people living with HIV, encourage people not to get tested because if you don't know you're positive, you can't be guilty, and push people into the shadows. We also know that these laws disproportionately target women, and particularly women of color. You will hear from the Positive Women's Network about this issue, but women comprise a little more than 10% of HIV positive residents of California, but comprise almost half of the prosecutions, and African American women are particularly targeted. This bill will eliminate these felonies and will merge HIV into the general misdemeanor for infectious diseases that has existed for a long time. I want to also note that we have worked closely with the health officers and have made an amendment to the bill that has caused the health officers to remove their opposition to the bill. We have a extremely broad coalition behind the bill. You have the letter. It's probably the broadest coalition I've worked with. Public health, civil rights groups, women's health groups, and I ask for your support. I'd like to give Assemblymember Gloria the opportunity to make remarks as well.
Okay. Thank you, Senator Weider, and thank you, Chairman Wood and members of the committee. I picked up on what you're putting down. I appreciate the motion by Mr. Santiago and the second by Mr. Ridley Thomas. I would just associate myself with the comments of Senator Weiner and encourage you to listen closely to our other witnesses who I think have extremely powerful testimony to explain why this is personally very necessary. But I would just, the only thing I would add is that when I've talked to some of you individually about this piece of legislation, I recognize while it brings up perhaps uncomfortable issues, but I would point out that discomfort has nothing to do with current data or with science. It has everything to do with outdated and bygone policies, conceptions that this policy represents. And while all of us are in the business trying to update these policies, this is very much what we're trying to do here by trying to match what we're doing here in California with regard to HIV to match the times that we live in. I think some of you may not be aware of the fact that we can today have someone who is diagnosed with HIV to have a long and normal life. This is not the death sentence sentence that it once was. And the truth of the matter is we can go even further by having medication, pre-exposure prophylaxis, where you can take a pill every day and prevent acquiring HIV. So the world has changed significantly. Our laws have not. And the net effect of this laws is to communicate stigma to those who have HIV. It makes them less likely to get tested and to come into care. And what it means is the policies of the state are actually perpetuating this epidemic. I ask for your aye vote as a means of showing that we want to align our policies with good data and with science, and to make sure that more people come into care, get tested, so that we can be the generation that ends the spread of this terrible epidemic. But you don't need to hear any more from me. Mr. Chairman, we have some wonderful speakers I hope you give your full attention to.
Thank you. And Mr. Chairman, we do have two witnesses here today. Dr. Tomas Aragon, who is the health officer for the City and County of San Francisco, as well as Thandi Harris, who is with Positive Women's Network, which is one of our sponsors.
Great. Thank you. Please.
Good afternoon. My name is Dr. Tomas Aragon. I'm the health officer of the City and County of San Francisco, and I direct public health services, including communicable disease control. I'm also a member of the Health Officers Association of California and the National Association of County and City Health Officials. I exercise legal authority to protect the public's health, and I have done so for more than 20 years. San Francisco strongly endorses Senate Bill 239, which modernizes criminal penalties for the exposure to and transmission of infectious diseases that is consistent with public health science and practice, and supports the legal authority of local health officers. Local health officers play a unique and vital role in responding to emerging microbial threats like Ebola, SARS, MERS, pandemic influenza, Zika virus, and others. SB 239 ensures that health officers continue to have the necessary authority to respond rapidly to emerging infectious diseases. SB 239 is consistent with core public health principles to prevent transmission of infectious diseases. With HIV, these core principles are deployed by education, by counseling, testing, and referral for treatment if positive, and evaluation for PrEP if negative, and by ensuring access to health and social services. Knowing one's status is essential to positive sex health choices. Any barriers to testing and knowing one's status impedes our public health objectives. In 2014, San Francisco launched the Getting to Zero initiative. San Francisco proposes to achieve zero new HIV infections, zero HIV deaths, and zero HIV stigma. And the city has been remarkably effective at improving the health of people living with HIV and reducing new infections to record lows. We owe our success to an engaged and empowered community and to good public health science and practice. In contrast, and in alignment with the National Association of County and City Health Officials, severe criminal penalties have never been proven to be a good public health strategy. Furthermore, a CDC study in 2017 found no association between HIV and AIDS diagnoses and criminal exposure laws across states over time, suggesting that these laws have no detectable prevention for HIV. The bottom line is this: from a public health perspective, threats of criminal penalties do not work, never have, and probably never will. The bottom line is this, is that the San Francisco City and County, the San Francisco Department of Public Health, we strongly endorse Senate Bill 239. I have reviewed the arguments in opposition, and they do not represent local, national, and international public health consensus on this matter. Thank you.
Please go ahead, ma'am.
Good afternoon. My name is Thandi Harris, and I'm a woman living with HIV and an HIV advocate at Women Organized to Respond to Life-Threatening Diseases World in Oakland, and a physician in training, and a member and policy fellow at Positive Women's Network, PWN. PWN is basically a national membership body of women living with HIV, including women of trans experience and our allies. PWN is one of the co-sponsors of SB 239. As a woman of color living with HIV, I believe SB 239 is necessary to ensure the safety and dignity of women living with HIV. While some have argued that these outdated laws protect women from acquiring HIV, there is absolutely no evidence of this. Instead, they reinforce HIV fear and stigma, leaving many people afraid to take an HIV test or disclose their status for fear of prosecution. In California, these laws have been disproportionately used against women, especially women of color, and make women living with HIV more vulnerable to violence and coercion. According to the Williams Institute, women make up 40% of the people criminalized under existing laws, even though women are only 13% of the people living with HIV in California. And while black women make up only 4% of people diagnosed with HIV in the state, they are accounted for 21% of those criminalized under these laws. The disproportionate impact on women may be even more drastic because it is likely that trans women are not accurately included in these statistics. The current laws make women living with HIV more vulnerable to violence and coercion. These laws provide an additional tool for an abusive partner to exert power over someone living with HIV. And the threat of persecution prevents many women living with HIV from leaving violent relationships. For example, one of our Latino members, a Latina woman living with HIV, was in an abusive relationship for 4 years. Every time she attempted to leave, her partner threatened to come after her using HIV criminal laws. He also threatened her to have her children taken away, which is a fear many of the women have under these laws, and just this prospect alone is enough to keep them trapped in a cycle of violence and control. These laws create an environment of legally sanctioned stigma that keeps women living with HIV in fear and unable to trust the institutions that should protect them. Another one of our members, an African-American transgender woman, told us, I didn't report my rape because I was worried about being prosecuted for non-disclosure to my rapist. These laws need to be changed in order to address the stigma, fear, and violence that still shapes the lives of too many women living with HIV. On behalf of PWN members who are women living with HIV who support these changes, thank you for your consideration.
Thank you very much. Appreciate it. Others in support, name and organization only, please.
Good afternoon. Sorry.
It's on.
For who?
Becca Kramer, ACLU of California, proud to be sponsors, and also representing Black AIDS Institute and AIDS Project Los Angeles, APLA Health, also both sponsors and not able to be here today.
Okay, thank you.
Good afternoon, Mr. Chair and members. Joe Michael for Equality California. We are also a co-sponsor of this bill, and I am stating the support of Lambda Legal as well, who is not able to be here. We urge the committee's support. Thank you.
Thank you. Please.
I was very moved by the testimony, so I'm very proud to issue support on behalf of the County of Alameda. Thank you for this bill.
Great, thank you.
Mr. Chair and members, Stuart Thomas on behalf of the California Medical Association support.
Thank you.
Alicia Lewis on behalf of the California Latinas for Reproductive Justice and proud support.
Great, thank you.
Gregory Kramer on behalf of Planned Parenthood Affiliates of California in support.
Thank you.
Kathy Mossberg, San Francisco AIDS Foundation in support.
Thanks.
Linda Way with Western Center on Law and Poverty in support.
Great, thank you.
Amanda Wallner, the California LGBT Health and Human Services Network in support.
Great, thank you.
Jim Lindberg on behalf of the Friends Committee on Legislation of California. We're a Quaker-based lobby in strong support.
Thank you.
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Thank you.
Emily Marika Sanders with Project Inform and HIV and Hepatitis C organization in San Francisco.
Thank you.
Strong support. And Kat DeBerg with the Health Officers Association of California. We want to thank the author and the sponsors and the committee for working with us to make sure that we could remove our opposition to the bill. Thank you so much.
Thank you. So, anyone else in support? Okay, opposition? Is there anyone in opposition? Seeing no one, will bring it back to the committee. Questions or comments from the committee? It's been moved and seconded. Mr. Weiner, what, you have a question? Please.